Okay, welcome to yet another lecture on your trainer course. This is on vital substances and it's the second one, week 6, and my name is James O'Sullivan and I hope you find this useful. So first of all, let's review Qi. First of all, we learned that Qi is made from food, drink and air, and also we have a certain type of Qi that's given to us by our ancestors or by our parents. Secondly, Qi is the energy of the body, and it's also in a material form as well. So it can be both immaterial and material. Next, we need to acknowledge that it's known by different names, mainly according to the location or to the origin. We had Gu Qi, which was originated from food. We have Gong Qi, which originates from the air that we breathe. Both of those combine to form Zhang Qi, which is Qi of the chest, or gathering Qi of the chest. We also had Yuan Qi, which is our ancestral Qi, given to us by our parents, given to them by their parents, and so on. The DNA, or the genetic blueprint of a person. We had Zen Qi, which is the upright Qi, or the true Qi of the body. This represents the total Qi of the body. And we also had the Zhang Fu Qi, which we're going to be dealing a lot with when it comes to differentiation of patterns of disharmony, according to the theory of traditional Chinese medicine. And you might look back on your previous notes and you'll see the creation of Qi taking place with all of these elements as well. Okay, so next let's move on to the functions of Qi. And the primary function of Qi would be transforming and transporting. So let's have a look at transforming. As we looked at in class already, we've seen that Qi transforms food into energy, or into Gu Qi. It also transforms fluids within the body. It transforms fluids into urine. It processes blood, and that's a form of transforming as well. It transforms Qi into blood. When we look at transporting, we can see that Qi transports Gu Qi upwards into the upper chest. It also transports fluids to the skin. It also transforms Qi downwards. So again, when we eat food, it travels by peristalsis along the gastrointestinal tract. This is the downward transportation of Qi. Qi also transports upwards, and in fact Qi transports in all directions. The next function of Qi we're going to look at would be protection, or defensive Qi. And this is Qi that protects the body from external pathogenic factors, colds and flus and other diseases that come into the body from the outside. And it's particularly lung Qi that does this. And of course you may remember when Zen Qi was divided within the body, we had Wei Qi, W-E-I, Qi. That was part of the protecting function of Qi. The next function of Qi we have is containment, or holding. And we learn here that the spleen Qi holds the blood in the blood vessels. So a disharmony of containment would be a person that bruises easily, or somebody who loses blood when they shouldn't. Kidney and bladder holds the urine in the bladder until it's time to release it. And the lung Qi holds the sweat. So this is a function of containing, and there are other examples as well. Raising is also a function of Qi, and this is a spleen Qi function in particular. It raises the organs, it holds the organs in their place. Qi also has a function of warming, and this again, we remember back to when we looked at Yang, we said that Yang warms the body. Well, Qi is Yang in nature as well, particularly kidney Yang, and spleen Yang also warms the body. So those are the functions of Qi. Let's take a look at some of the disharmonies. There are 4 main disharmonies of Qi, or imbalances of Qi. There's the deficiency of Qi, for example, and this may affect the lungs with symptoms of shortness of breath. The stomach and spleen Qi deficiency may be poor appetite. and the body in general symptoms of fatigue and weakness. These imbalances may affect many parts of the body at once, or within a particular meridian, or maybe an organ or an area of the body as well. Let's just take a look at Qi deficiency, and this is a simple clinical picture. The main clinical manifestations of a Qi deficiency would be fatigue, shortness of breath, a pale face where Qi is not sufficient or not strong enough to bring blood into the face, a weak spirit or weak vitality, excessive sweating. This is where the sweat glands are unable to hold the sweat or to stop it and prevent it from leaking out. You would call this being unfit. Remember? Tiredness, lethargy, apathy, exhaustion, disillusionment is also Qi deficiency. A dislike of talking or speaking, spontaneous sweating, and all of these symptoms would be made worse by exercise. The tongue would have a pale body with a thin coating, and the pulse would be empty. If we look at sinking Qi, the main clinical manifestations would be a bearing down sensation in the abdomen, or prolapse of the organs. This would be where everything is falling down, where the spleen Qi is unable to hold the organs in their place. A common example of this would be hemorrhoids. And the tongue again would be pale with a thin coating, and the pulse would be empty. When we look at rebellious Qi, we can see that rebellious Qi is where Qi goes in the opposite direction. So coughing, for instance, with regard to lung Qi, belching regarding spleen Qi and stomach Qi, vomiting regarding stomach Qi. Hiccups can also be rebellious Qi as well, and dizziness can be rebellious Qi. We look more at rebellious Qi in terms of deficiency and excess later on in the course. The tongue is a pale body with white coating, or it may be red with a yellow coating as well. And the pulses may be wiry, or it may also be rapid, or it may be empty as well, or weak. The next disharmony that we look at is a Qi stagnation. And the main clinical manifestations of a Qi stagnation, these usually include some sort of pain or distension or a stuck feeling. Distended or dull pain in the hypochondrium, for instance, or chest. Pain, it's not fixed in the chest. When we ask our patients where's the pain, they find it difficult to describe exactly where it is, to put their finger exactly where it is. It tends to move from place to place. They may also suffer from sighing or hiccup, abdominal distension, fluctuations of mental state, or they may be stuck in a particular mental state, such as melancholy or unhappiness. They may also have a lump in their throat, a feeling of difficulty in swallowing, especially when under a little bit of stress or under pressure. Painful periods is a Qi stagnation. PMS, PMT, distension of breasts before the period, and premenstrual tension and irritability, as I mentioned previously. And in this case, the tongue is normal color and the pulse is wiry, or it may also be tight. So those are our four main patterns of disharmony regarding Qi, or our four main imbalances of Qi. Hope you found this lecture useful. We're really getting into the theory of traditional Chinese medicine now, and it's probably beginning to show its complexity. However, I would strongly encourage you to stick at it, take on board the information that you're presented with, and eventually the penny will drop. Okay, thank you, and until next time, sláinte.